Welcome back, Titans. We are doing patient history today, and we're talking about the mnemonic sample. What does the mnemonic sample mean? How is it going to better help you identify what's going on with your patient, get a backstory and maybe some medications and history, and try to put all the puzzle pieces together and get a good understanding of where your patient is currently. So we know that in our primary assessment, we've got our chief complaint, our ABCDEs or XABCDEs. We've also identified a transport decision. Are we staying on scene to continue assessing and evaluation? Or are we going to load our patient up because maybe they're unstable, we need to get into a hospital? Now we are looking at the patient history, OPQRST and sample. Whereas OPQRST more focuses in on pain or distress or discomfort of a patient and trying to get the severity and quality, sample is going to give you a better understanding of the overall history and allergies and everything else of the patient's current medical condition leading up to this point. Going to help you put those pieces together. So right off the bat, let's start off with S. It's going to be signs and symptoms. Now we know that signs are something that you as a clinician in the field can see. This is a clenched fist over the chest. This is an open wound. This is a maybe hives on a patient's chest from an anaphylactic reaction. Those are things that you can see, and symptoms are things that the patient is going to tell you that's going on internally that you can't see. This is nausea, chest pain, dizziness. These are the things that you cannot see that the patient is going to have to answer the question and tell you. So, signs and symptoms. A is for allergies. This is a big one, especially if you're going to initiate some sort of medication administration. We always need to be asking our patient, what are you allergic to? There's a wide range of things that are people allergic to. Anywhere from aspirin to opioids to penicillins to IVP dyes. This is important, especially before you initiate a medication administration. So we want to know what our patient is allergic to. M is for medication. What is your patient currently taking? They could be taking no medications. They could be taking 20. This is where we're diving back into our pharmacology to understanding the reactions of medications and what the patient's taking. Good questions for this section is, how often do you take those medications? Did you take them today? And do you take them consistently? Okay. P is past pertinent medical history. Now we want to know what our patient has going on, that they have been diagnosed by a physician. Have they ever had any surgeries? Do they have high blood pressure? Have they ever had a heart attack? If so, what year or what time? Were there any complications? So past medical history is going to give you a very good understanding of where your patient is at today. And maybe you can identify one of those things that maybe is leading into what the patient called for today. L is going to be last oral intake. We want to ask our patient, when is the last time you ate something? Maybe they had a turkey sandwich a couple hours ago. Maybe they haven't eaten in 2 days. We want to know what they've taken, what they've eaten, what they've drank. So, and then E is events leading up. What were you doing when this all started? It's like the mnemonic OPQRST for O for onset. It's what were you doing when this happened? What were events were happening when you started feeling this way? Were you sitting on the couch watching TV? Were you running a marathon? Were you exercising at the gym? What led up to this current medical complaint today? So, sample history, deep dive into your patient's chief complaint, and hopefully it gives you a better understanding and a idea of how we're going to treat our patients. Hope this helps. See you on the next one.